Hi, my name is Alexis Connolly, and I will be discussing the mineral zinc and its relation to plant-based diets. The purpose of this study is to find ways to improve zinc bioavailability and absorption in individuals that consume plant-based diets. The objective is to demonstrate that phytase is an effective ingredient in removing phytate and therefore improving the bioavailability and absorption of zinc. Therefore, demonstrating that vegans and vegetarians can consume a plant-based diet and still receive the recommended amount of zinc from the food they consume. The research hypothesis is that the enzyme phytase is effective at making zinc more bioavailable in plant-based diets. Zinc is a mineral found in enzymes responsible for protein transcription and DNA replication in cells. Common enzymes containing zinc includes carboxypeptidase, alkaline phosphatase, and DNA RNA polymerase. Zinc can be found in meat, poultry, and seafood, such as crab, lobster, and oysters. Zinc can also be found in small amounts in plant sources such as nuts, seeds, legumes, and oats. Zinc deficiency occurs when zinc absorption is less than 2 to 3 milligrams in infants and toddlers, 3 to 5 milligrams in older children, and 8 to 9 milligrams in adult women, and 11 milligrams in adult men. There are three main reasons why zinc deficiencies occur: poor intake, reduced absorption, and abnormal utilization within the body. These three issues could be caused by genetic disorders, food choices, or counteracting nutrient interactions. Symptoms of zinc deficiency include alopecia, eczema, night blindness, lost sense of taste or smell, loss of memory, impaired coordination, and reproductive system and growth retardation in extensive zinc deficiency. It could also lead to hypothyroidism, which is an underproduction of thyroid hormones. Zinc toxicity is when there is an absorption of more than 200 milligrams per day. Symptoms of acute toxicity include abnormal pain, lethargy, anemia, dizziness, nausea, vomiting, and diarrhea. If toxicity levels increase beyond 225 milligrams, symptoms may include seizures, fever, urinary retention, low blood pressure, and a metal taste in the mouth. In a research article by K. Patel, investigators discussed the reasons why zinc levels are low in foreign countries and how consuming plant-based diets can be the cause. They also found ways to increase the bioavailability of zinc in plant-based foods. They indicated that absorption of plant-based micronutrients such as zinc could be as low as 1%. This is due to low levels of zinc as well as components that inhibit its absorption within the body. Components of food that contribute to the lack of absorption of zinc include tannins, phytic acid, which is phytate, dietary fiber, and calcium. Zinc from cereals, legumes, and nuts cannot be fully absorbed due to phytate binding with zinc molecules in the intestines. Phytates could be the main cause of zinc deficiency in patients that consume vegan and vegetarian diets, especially those supplementing with soy as a primary source of protein. This information is helpful when distinguishing reasons why zinc is problematic to obtain from plant-based foods. In another research article by M. Foster, researchers questioned the connection between phytic acid, zinc bioavailability, and indicators of zinc balance within the body. Based on the study, healthy and diabetic women both had significant levels of phytic acid from whole grains, which shows that phytate still contributes to zinc deficiency in individuals no matter their health status. In an article review, researchers questioned the effect of vegetarian diet on a pregnant woman's zinc levels. The goal was to determine if vegetarian diets were better than omnivore diets. Based on the results, the vegetarian diet had no ill effect on the health of the mother or the fetus. However, the zinc serum levels were lower than the recommended intake. In a study by F. Fayette Moore, researchers wanted to measure the levels of certain nutrients that are commonly deficient in women. The common deficiencies included iron and selenium, which shows that metal nutrients are commonly deficient in women of menstruating age. Pierre-E.J. conducted a study to determine if conventional processing methods had the ability to remove anti-nutrients such as phytate from chickpeas. The fact that soaking the chickpeas has the ability to remove anti-nutrients is significant when considering natural methods for increasing zinc absorption. The study by B. Trois tested the ability of phytase from Aspergillus niger in removing phytate from plant-based foods in order to improve the absorption of zinc. The significance of this study is that the enzyme phytase can be used as a supplement in plant-based diets and improves zinc absorption. These findings provided information on why zinc is difficult to absorb in plant-based diets, what anti-nutrients cause this inability, and techniques to remove anti-nutrients and improve bioavailability. Based on the current literature review and anticipated findings, phytase and other processing methods will be effective at removing phytate and therefore making zinc more bioavailable for absorption. With this research proposal, the purpose is to improve research on the enzyme phytase in plant-based foods consumed by women of childbearing age. For this research proposal, it is applicable to perform a quantitative and qualitative study to measure the amount of zinc absorption after reducing the amount of phytate in the diet. For the test and analysis portion, a one-way analysis of variance t-test ANOVA would be conducted. The experiment will span a 6-month period, and surveys will be sent out on a Tuesday with a 1-week window will be provided for individuals to decide if they want to participate in the study. Zinc measurements will be determined quantitatively by testing the serum zinc and plasma zinc levels after the experiment. The qualitative measurements will be based on a 12-question survey where the test subjects would describe the characteristics of their skin, hair, eyes, energy level, and coordination before and after the 6-month period. Experimentation would be performed on 3 groups, including a control group 1. Group 1 will be a control and consume a plant-based diet without supplementation of phytase. Group 2 will consume a plant-based diet with endogenous phytase from fermented food sources. Group 3 will consume a plant-based diet with fortified phytase from Aspergillus niger. The sample population will include menstruating women of age 18 to 34 that consume plant-based diets in the Southeast region. Test subjects will have initial zinc tests to determine if they meet the quantitative requirements prior to experimentation. Test subjects will need to have low levels of zinc in their serum zinc and plasma zinc tests in order to meet the requirements for the experiment. Their zinc levels cannot be linked to any genetic disorders related to zinc digestion or absorption. Qualitative characteristics of the test subjects would also be examined, including skin, hair, and eyes. A voluntary qualitative survey would be used to see if the test subjects qualify for the quantitative zinc test and analysis initially. The sample size would need to be 385 test subjects. There would be an initial statement and survey sent out through an online survey system to 963 people, asking for volunteers to participate in the study anonymously. This is based on a 40% response expectancy rate. An in-person assessment will be conducted in a medical facility at the end of the study in order to correlate the survey results with actual results for more information for discussion. I would need our IRB approval because of experimentation on human subjects. or medical tests and surveys are involved. The data will be reported anonymously by removing any identifiers related to the test subject's identity, such as name, birth date, and postal code. The survey data will be easily formulated and reported due to the online survey system. Any research data obtained from the surveys will be sent directly to the test subjects. All other data from the quantitative analysis will be communicated through a secure electronic portal. Both qualitative and quantitative data will be illustrated aggregately, and any outlier information to the majority will be noted separately as case-based data. If phytase does not decrease the amount of phytate in plant-based foods, then the null hypothesis that phytase does not have any effect on zinc bioavailability is true. Risks associated with the study include psychological strain from complying with the requirements of the experiment and possible physical harm from the zinc test methods. It is also possible for information to be accidentally identifying for some test subjects. Possible benefits include increased zinc and other mineral levels, increase in overall nutrient absorption, and increased knowledge of what plant-based foods and processing methods. These risks and benefits are reasonable in relation to the study because increased knowledge is necessary in order to provide plant-based consumers with solutions to nutrition-related issues. Thank you.